everyone, our group has IV contrast agents used in MRI. My part is the overall clinical use in radiation therapy. First off, although MRIs are expensive and the patients have to pass an MRI questionnaire, MRI is still a commonly performed examination, especially for neurological, cardiothoracic, and abdominal diseases. MRI has superior contrast resolution compared to that of other modalities, and so therefore can distinguish soft tissue structures that cannot be resolved by other imaging techniques. MRI primarily uses gadolinium-based contrast agents. Sorry if I pronounced that wrong. This is a heavy metal contrast. These behave similar to the iodine contrast agents used for CT and fluoroscopic imaging. Examples of MRIs using contrast and radiation therapy are as follows. Clinical indications for ordering MRI with contrast may include, but are not limited to, the following. First, I'm going to describe MRIs that are used for the extremities. These do include the use of contrast agents. We have osteomyelitis for any extremity, spine, or general infection, soft tissue mass of any extremity or joint, palpable mass neuroma, a tumor of the lower extremity. This includes the femur, tibia, fibula, and the calf. Next, the brain. An MRI would be used for the brain in the following situations: report of a tumor, history of cancer, Bell's palsy, seizures, known acoustic neuroma, prior surgery for acoustic neuroma, report of pituitary adenoma tumor, abnormal prolactin, galactorrhea or amenorrhea, history of visual disturbances, ptosis, optic nerve, soft tissue neck, and a mass in the neck, Next, an MRI would be used in the spine for the following situations: for the cervical spine, multiple sclerosis, spinal tumor infection or cervix; thoracic spine, multiple sclerosis, spinal tumor infection, cervix, or previous surgery within the last 5 years; the lumbar spine, spinal tumor infection, cervix, or post-operative spinal surgery. Other parts of the body include, first off, the chest. MRI would be used to evaluate mass or pain, rib cartilage or diaphragm. These could all include masses. Next, the abdomen includes tumor, liver, or pancreas evaluations would be when an MRI would be used to evaluate. Also for the liver, pancreas, and renal, which is known as the kidney, this includes like any mass, any palpable masses or pain. Next, the pelvis would be used for pelvic pain, mass, or surgical planning for radiation therapy. This could also, patients could complain of pelvic pain, palpable masses, surgical planning, again, gynecological abnormalities would be used for any type of female pelvis. Next, the renal, report of a renal tumor, kidney tumor, or mass. Next, the breast, history of breast cancer, abnormal diagnostic mammograms, abnormal diagnostic ultrasounds. This includes and requires recent mammogram study. Typically, when the previous mentioned items are ordered, they are ordered with and without contrast. Likely 2 images will be taken, one with contrast and one without, to compare the 2 images. And as I described all the different anatomy parts, I described when an MRI would be used with contrast. Lastly, I'd like to describe these images that I have here on my wall. This is an MRI of the brain. You can see the no contrast and after IV contrast is used in the brain, and you can see this tumor show up in the brain, as before it did not show up without the contrast. Next we have the breast. This was an interesting photo that I found, because this shows a normal mammogram what it should look like, and this over here in the middle shows the MRI image before the contrast, and over here last image shows the MRI image after contrast, which shows a tumor light up. Over here I have an MRI used with contrast of the abdomen. You can see the kidneys, the liver, the spleen over here, and then you can see, I'm not sure what they're, they're just looking. I don't know if it's a routine or what, but you can see when the contrast is used how much of a difference that can make. Lastly, over here I have a page of a couple of references that I used for my presentation. Thank you all.